and welcome. My name is Dr. Bhavna Pathak, a hematologist-oncologist here at MemorialCare. I also serve as the medical director for our integrative oncology program. I am so thrilled to welcome you to our Let's Nourish Ourselves module, where we're taking a look at how to nourish our mind, body, and spirit. Today's topic is nutrition support, and I'm joined by the fabulous Jamie Gleason. Welcome, Jamie.
Hi, thank you for having me. I'm happy to be here on behalf of Saddleback Memorial Hospital. We worked hard on this with our sister hospitals, Orange Coast and Long Beach Memorial.
Yeah, a truly integrative approach to sharing this information, much needed information to our patients. What to eat and how to nourish ourselves is one of the most common questions I get in the clinic, and it's really valuable that we can use your expertise and leverage your expertise. Today's topic is particularly important. Sometimes I have patients who cannot get enough food or are not able to nourish themselves through their mouth, whether it's due to the treatment such as radiation or sometimes due to the symptoms such as nausea or vomiting. And so we need to rely upon external supports. Can you explain to us what nutrition support is, Jamie?
So nutrition support, like you said, is when you're not getting enough by mouth, another method to feed someone. So feeding through a tube or feeding through a vein, feeding through a tube called enteral nutrition, or feeding through the vein called TPN.
Yeah, parenteral nutrition, is that right?
Mm-hmm.
Okay, so let's talk about enteral nutrition or tube feeding first. And I think of it as like entering the body through the gut, which is the first way we think of food entering our body. What can a patient expect if tube feeding is recommended?
So there are two types of feeding. There's something called NG, nasogastric tube feeding. That's a short-term method. And there's also something called a PEG, which is a long-term method, usually about 3 to 4 weeks. If it's needed. And we prefer the enteral nutrition because that mimics the normal digestion and the gut. And also it's good for your immune system. It can reduce infection. And also a lot of patients I've had don't realize that you can actually eat if the doctor allows and get fed through a tube. So it doesn't have to be one or the other. That's the common misconception I hear. You can also receive all your nutrition needs through it, all your vitamin, minerals, and water needs.
Wonderful. So I love that. It's trying to stick with nature, again, using our gut, because it has all these other benefits, like our immune system and the digestion, all those aspects. So tell me a little bit more about that. Once the tube is in place, what's next? How does one get tube feeding?
Yes, so the dietitian, we come up with the recommendations for what formula, how much to provide. And then once the doctor approves that, then the actual formula comes from the pharmacist. And it's kind of like a medication covered by your insurance, where the insurance would approve it and send it to your home. And then also there are different feeding methods. So one method is called bolus feeds. And what it is you get a can of formula and then a syringe, and you syringe it in. And the nice thing about that is if the patient is mobile and walking, they can like go to their chemo or radiation or go about their day and then come back and provide another bolus feed. It is about 4 to 6 cans a day on average, and usually it takes about 15 minutes or so. And the next feeding method is called gravity. And so this is where you have an IV pole with a bag, and you're gonna pour in 1 to 2 cans. And then it's going to let gravity drip in to the patient. It takes a little bit longer, but it takes less times a day to do that. You can do this this is good for like families that need to be like more hands-off, less manual work. And then the last method is called continuous, and that's where it's going to be continuously dripping through an IV in a pole. And this is a nice method for patients that have problems tolerating the tube feeding, that tried bolus already, or it might be good for anyone that is eating but not quite enough. You can eat in the day and then just get it at night also, or it could just go 24 hours a day. And then one thing to keep in mind is the tube feed provides all the vitamins and minerals and protein your body needs, but it lacks the hydration or water. So you need to make sure you flush with water. That way you don't get dehydrated, and that way the tube doesn't clog.
Yeah, wow, thank you so much for describing all of that. I know for many, nutrition support, especially enteral feeding, is something that is quite foreign, right?
Yes.
Food is such a central part of our culture and socialization, and to turn nutrition and nourishing ourselves into this new exercise can feel challenging for many. So I think something important to remember as we, have you here is just that there's a community of people ready and willing to help you. So whether or not it's your family members or your team here, we're here to help you. And so beyond nutritional support, not beyond nutritional support, but beyond enteral support, there's something called parenteral support, or what means intravenous nutrition or through your veins. Can you tell me a little bit more about that, why that might occur, and when might this be a good option for patients?
Sure. So obviously the enteral or feeding through tube is preferred, but sometimes that's not an option, such as someone that has an obstruction or just had a major surgery and the doctor isn't ready to feed them that way. So there's something called TPN, which is total parenteral nutrition, and it's feeding into your vein. It's delivered from the pharmacy, just like the enteral nutrition, and we can help recommend what to provide. It meets all your calorie and protein and vitamin and mineral needs. You do need to make sure you monitor your labs though, because there is risk with feeding into those veins. So you need to keep an eye out, especially watching the blood sugar, because there's risks of elevating blood sugar, elevating triglyceride, and risk for infection. So there's some consequences that could happen possibly. So this is the method when the tube feed is not an option.
Okay. So this is a really novel way to also get your nutrition through an IV when it's just not possible through your gut. And it's nice to know that there's a system set up to help offer this and monitor it and watch out for some complications that are unique to this method. So now, is there a process for transitioning off nutrition support, once you're done with treatment or you've healed up? Or you're making strides, you're making progress forward. Can you tell me a little bit about that?
Yes, so ultimately it needs to come from the doctor when a patient is ready to eat again, but we can help make recommendations and guide through the process. We sometimes the patient will need to be seen by a swallow therapist, and their job is to assess the swallowing function, and we need to get an okay from them. But ultimately, as your oral intake gets better and increases, you can start decreasing the tube feed or TPN or the nutrition support over time. And then once you don't need to be on the tube feed anymore, they can remove those tubes. But ultimately, it's the doctor that has to say, we can make recommendations, but it's the doctor that says okay to eat and okay to come off.
Okay, well, there's a lot of pressure on us, Jamie, as a doctor.
I get those calls sometimes.
But I truly agree that it's a joint effort,
Yes.
from the patient to the dietitians like yourself to myself as the oncologist. Just a team effort at making sure you're optimally nourished. I think this is just such an important reminder to nourish ourselves however we can, right? So to that end, I would love for you to do the honors to share our slogan.
Sure.
All right?
Let's nourish ourselves.